Will come to order. Determine if there's a quorum present. Commissioner Wardlaw, Commissioner Nettleton, Commissioner Flores, and myself. We have a quorum. Stand for the Pledge of Allegiance. Commissioner Wardlaw, if you'll lead us in the Pledge of Allegiance, please.
Allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Real quick before we get started here, we were in a meeting this morning about 10 o'clock, Commissioner Nettleton and myself, with individuals from school district, the emergency management from the city and the county, port of entry, and some other individuals there, the sheriff. And we thought it was necessary to call this meeting in order to let y'all know what's going on and to come to figure out if there's something different than what we're doing that needs to be done. One of the things that was brought up was which offices are deemed essential. We're in county government, and I would say that almost every office right now would be deemed essential. There is a need maybe for some other precautionary measures in the areas that we have more people visiting. This, in my opinion, district clerk, county clerk. You have the building, the Fitzpatrick building, everybody in there. Y'all just have more people come in on an hourly and daily basis than the rest of us. Our county attorneys, to some extent, also. Our judges, I think, that's pretty much been taken care of. Is that right, Judge? Until for a couple of weeks. So we're going to get started with this real quick to tell y'all what we visited about earlier, and then just, you know, we need to put this into some type of perspective. I mean, there's like, a little while ago when I checked, like there's 41 deaths in the United States, but there's 1,800 cases. You compared that to the flu in the previous years, it doesn't sound like a lot, but this is one of those things that our medical community doesn't have a handle on, you know, and it's usually, and if you'll look at the areas that there's been more deaths, it's been amongst our elderly in a confined area. But it is something that we will take serious. The court on Wednesday and Thursday, we had communications with Colonel Gentile about the air show. He did ask if we had concerns, and I told him we had a lot of concerns. And I applaud him on what he did on canceling the air show. There's people coming from out of town, there's people coming from other bases, and just for the sake of safety, I think he did a great thing. There was supposed to be this afternoon also on Main Street, and it's been canceled where all the bands are coming in. Those individuals that were putting that on, they had called also on Thursday, and we visited with them, and I applaud them too for shutting that down. We would have canceled the circus, but it was too late yesterday to cancel it. But if it had been going on today, it would have been canceled. We right now, the court and myself, we're looking at events from I would say the George Palm Memorial Bull Riding this way that if we have a part in or have rented a facility to them, they're more than likely going to be canceled. The court will have to at some point decide if we're going to take that action with the George Palm Memorial. This court is taking this serious, and I will call up the sheriff right now to give y'all, I know that we've all had text messages a little while ago that there is a confirmed case in Valverde County, and Sheriff, and we just spoke about this morning, we spoke about it a little while ago. As of right now, we do not have, as far as you know, and we visited with the hospital a little while ago, a confirmed case in Valverde County. Is that correct?
That's correct.
So I think we were waiting on a result of maybe a couple of individuals that we might have tomorrow, sir. Is that, come on up, please.
So late yesterday, I was made aware of some individuals from another country that were visiting the maquila industry here. both in Del Rio and Ciudad Acuña. They visited, had minimal contact here at one of the maquiladoras, had some contact with individuals in Ciudad Acuña over a 3 or 4 day period of time. They visited local eateries here, stayed at a local hotel here. Upon them returning back to their country, they came down with flu-like symptoms. They went down to get tested. Those results of those tests will not be available till tomorrow. Tomorrow morning sometime. They've been quarantined at home. There was a total of 4 or 5 individuals that were here. Out of those, 2 have come down with flu-like symptoms. I was also advised a little while ago that prior to them leaving their country, their children had flu-like symptoms, so their kids were sick with the flu already prior to them getting here and then them leaving and going back and getting sick. But I visited with membership from the hospital because there's rumors going all over the place, and there is no patient or coronavirus case confirmed here in Valverde County.
Okay, thank you, Sheriff. The other thing, our employees, we have probably 3 or 4 that are out of the country. Last count, they're on vacation right now. I asked Juanita to contact these individuals, and as soon as they get back, to be self-quarantined for 14 days and not show up to work for the county. It'll be an item on the agenda. We'll see if the Commissioners Court want to take any other action, but I thought it was necessary to go ahead and take that action to make sure that between Monday and Wednesday, we don't have people that could have been exposed to show up to work here at the county. Juanita, if you'll give us a little bit of an explanation what you got from TAC as far as our coverage.
Good afternoon, Judge, Commissioners. I received an email earlier today, or this afternoon, from TAC in regards to our coverage on the insurance, and it reads as follows. Until further notice, TAC HEBP will cover the coronavirus-related care for all pool groups as set out below. Waive cost sharing for COVID-19 testing, no member out-of-pocket costs, including no copay for office visit and no copay or deductible for diagnostic and laboratory services specifically for diagnosing COVID-19. Please take note, this is a temporary modification to the benefit plan. And then they go on to address some precautions, hand washing and so forth to follow. And like I mentioned, this is only a temporary change that they've made to our plan.
Okay, thank you, ma'am. For the record, Commissioner Vasquez has stepped in, and I started without reading the agenda, one of the agenda items, but we'll discuss this under matters relating to emergency and/or urgent public necessity regarding the containment of the COVID-19 coronavirus. We've gone through, and we're looking right now, the court is, as maybe adopting other measures that some of the other counties have done. As of a little while ago, the governor declared all the counties disaster areas, and then the president actually declared it an emergency. So, with that in place, it gives us more authority. As a county judge, I hate saying I'm in charge or I can do, but at the end of the day, if we need to declare an emergency here or disaster, we've been working with Anna, which is talking right now, but we've been working with Ms. Markowski to figure out what our steps are going to be, either as a court or as a judge. We don't want to burn the barn down. I mean, this isn't, but we are going to have to take steps to make sure that our employees and, in essence, our constituents are protected. There's some areas that we've already identified in where our plates and our where you pay your taxes, and maybe even with our district clerk and our county clerks, these areas that you're sort of face to face with these individuals a lot, that we maybe, we're probably gonna end up putting some type of plexiglass between us, just to make sure that it helps us, have that area, have that little cushion between us. We really do need to follow the plans and the hygiene. I think as adults, we get away from that. But in reality, it only lasts so long on your hands. They keep telling us to keep it away from our mouth and our nose and our eyes. But, I will open it up at this time, commissioners, if y'all have any questions or anything. Go ahead, Commissioner.
I think you've done a great job of trying to get a handle on this. I know there's a lot of rumors out there, and every action that we're taking is based on the information that we have, and that information changes minute by minute. A lot of people believe this is not anything major, but we have to prepare for the worst and pray for the best. And so I think that's what we're doing here is preparing for what issues may arise in the event something does happen. I think it was probably said best this morning by an individual that was at the meeting that it's probably not a matter of if it shows up in Del Road, just a matter of when. So we have to do what we have to do to prepare to make sure that our employees and the people in this community are protected to the best of our ability.
We will be asking, reaching out to the other entities to have a joint meeting. One of the things that was discussed earlier was the information that we're putting out needs to be just as correct as possible. Like Judge Nettleton said, it is changing. I mean, all of a sudden, we knew it was here. We knew it was bad. And I think on Tuesday of this week or Wednesday this week, when it just like, all of us were getting inundated with phone calls. The school district has a meeting tomorrow, which some of the stuff that they've told us that they're going to try to implement, depending on what they decide, is pretty impressive. But it's going to take all of us with getting us same information. This is one of those deals that we're going to have to work together. The 14 days, they keep saying that this is what you need. We've taken the step with the individuals coming back that they'll have the 14 days self-quarantine. We will be asking for a meeting with the city, the school, and the hospital and the county, maybe to meet together. That way the public understands what's going on between all of us versus you getting bits and pieces. Visiting with the hospital a little while ago, the county was purchasing a building or been given a building that the hospital has, and my question to them was, what is it that y'all are doing to isolate? Well, my conversation with them right now is that they're going to have a screener at the front door. If you're having symptoms, you're going to be able to go around and get to one doctor, one nurse, that they're going to be able to do it. Well, if something bad happens and we end up more than one, where we put them? And what can we do as a county to help you succeed? Like I told them a little while ago, we have a building that we don't need to move, but it already has 50-some-odd rooms in there where they would be isolated. The biggest thing is, they're saying self-quarantine. Tomorrow, after the meeting, the school board meeting, we'll have a better picture of where we need to run come Wednesday. I will tell you in the conversations with the commissioners, and no votes taken, but in the conversations, if we need to declare some type of emergency or disaster, we will be prepared to do that. Is that correct, Ms. Markowski? Okay, so we don't want to do that. One of the biggest things going to be is, what our kids going to do when they're out, and you have businesses, you have the movie theater, stuff like that. I mean, everything that you read, everything that we're being presented with, they don't want you to gather in masses. So we have some events coming up that the county has leased areas. We're going to be looking at those. And I think, judges, I think y'all are done for a couple of weeks. Is that correct, Judge Cadena?
Yes, those are our records, and I'll forward those to your email, and these are some signs in the courthouse.
Right? So, everybody's trying to take steps. As elected officials, I wanted to make sure that all of y'all were here. If there's recommendations that y'all want to come up with and sort of present to us later on, please do. I'd rather not open this up right now to all of y'all, but I do want y'all to hear what we're trying to do. The panels for the congested areas, I think that even the JPs, y'all have a way of closing off your doors to where they don't come through your door and they can actually slide stuff underneath to help the spread when they're talking or sneezing or whatever. There will be more hand sanitizer stations put out. They're in the process, I think, right now of masks. We've ordered some masks and also the gloves. I think Edgar's already gone out and ended up with some gloves in case y'all want to use gloves to handle the money or the paperwork, or just to deal with them. I think that one of the main things going to be is that, you know, that y'all hand sanitize, your employees hand sanitize, and try to do that on a regular basis versus waiting, you know, all of a sudden, oh yeah, I remembered to do it now. You know, they're going to have to come up and do that on a regular basis as they're seeing customers. Let's move on to item 5, matters relating to an emergency and or urgent public necessity regarding a community infectious disease outbreak. And I think we probably already covered this a little bit. If there's an action that needs to be signed, we are prepared to sign it just to move this thing forward. One of the things that was talked about a little while ago, again, is just the gathering. You have groups that are going to be gathering. You have a circus that's going on right now. We're trying to get that, we will try to get that shut down. Just as soon as I leave here. Yes, sir.
I have a question. If there was to be a confirmed case in Valverde County, how quick or how fast can we set up testing labs?
We had that discussion earlier, and the problem is that we're at the federal government and states, we're at the federal government's mercy, because the testing, the kids, in order to get tested, I guarantee you every county and every city right now is asking the same question. We're at their mercy. It's one of those deals, our emergency management, I think, Mr. Sheedy, yeah, he just walked in, and Roland, they've been working on that. The question was asked by Bo earlier, you know, who's working on that? Well, those two are working on that right now, trying to get us some kits, trying to figure out how that's going to happen, and if they're going to be able to administer them here. And visiting with the hospital earlier, we don't have those kits here.
But, I mean, my question is, the public in general, not just kids. I mean, if there was a case confirmed here in the county, how fast can we act to start testing people?
What they're saying is that we don't have the kits to test. Did that answer your question? We do not have the kits here to be able to test. If something was to happen tomorrow, point blank, we don't have the kits to test. What the hospital and CDC are advising is that you self-quarantine, is that you stay in house, if you have symptoms. One of the symptoms, and we're going to get this out a little bit later to all our employees, one of the ways that and this seems like just a simple solution, but they're asking that you take a deep breath, hold your breath for 10, 11 seconds. If you begin to cough and you have respiratory problems, you probably need to go get checked. Now, if you go in at the hospital, what I was told, that's why I came into this meeting, was that they will have a screening station as you're going in. If you're doing broken arm, broken leg, broken this, or something like that, does not have to do with a respiratory illness or infection. They're going to rush you into here. But if it has to do with respiratory or something like that, and they think that you've been, you know, symptoms of this, they're going to send you somewhere else in the hospital to try to isolate you from everybody else. I asked, how many of those rooms do you have? And as we were talking, she says, we have an isolation room. It didn't say rooms, she said room. So, in saying that, you know, the next question was, well, what happens if these tests come back on tomorrow, Saturday, positive, and we have an idea of how many people they've come in contact with? That was my concern. At the end of the day, when they show up, when they say, I'm feeling bad, these are my symptoms, what are we going to do with it? You know? And the answer to that was that on Monday we're having another meeting to come up with the plan. So they're going to be having another meeting on Monday. I did ask a little while ago if they would please keep us informed of what's going on. This morning I thought the hospital was going to show up to the meeting we were having, but they were having a meeting at the exact same time. The answer to your question, shit, people don't know. I mean, we were having that frustration at 11 o'clock. I mean, and this thing here is just changing every minute. I mean, it's like, you know, it's okay, now it's really, really bad. I mean, the school district, like I said, we've got people, we've got over 100 kids and teachers out of the country, in Spain, everywhere else. You know, one of the concerns that we had a little while ago is if you're coming through the U.S., they're gonna check you to somewhat. But are they doing that in Mexico? And we do know that by the conversation we had earlier, we already have kids that were in Spain, other areas that are getting flights into Mexico. Their parents were able to get them into Mexico, not in the United States. And heck, they're gonna drive to go get them, or figure out some way to get them from Mexico over here. So we don't know what the Mexican government's doing. And at the end of the day, you know, the United States are only checking people that have symptoms. So, you know, we're not to say we're in bad shape, we just don't know. And that's the problem is that we keep asking questions and we're not getting answers. We will let everybody know everything that we've been told and that we know, but I think at this point, you know, in visiting this morning, heck, there's more questions right now than we had, with no answers to than we did before we went and did the meeting. I mean, it's one of those things that we went in thinking we knew more or less which way we were running, but, you know, we need to put a stop to, we don't have any confirmed cases in Del Rio right now in Valverde County. We don't have it. So, you know, as soon as we get that, we will put that out, and we will do everything we can to figure out where this individual was at, who he was with, which we already know that, and then we're going to go through the process of making sure that if those individuals have symptoms, that they either get treated or self-quarantine. I mean, this is one of these situations that, you know, could we have done more? Do we do more? I think at this point, we're going to work with what we've got. We're going to try to figure out a way to minimize the contact between individuals. The thing did come up today, what is absolutely necessary? What are the departments that we have? Which departments are absolutely necessary? It's real hard to pick in county government a department that doesn't need to be here. So we're going to try to minimize the impact that these individuals, when they come up and interact with our employees, minimize that impact. Either by putting up screens, putting up something, you know, we're going to have to figure that out, and we're going to have to do that now. You know, the hand sanitizing, that's going to help, but that's not going to be enough. And let's be realistic. And again, I'm not trying to set the house on fire. You know, let's not leave here just burning everything down. That's not necessary. When you look at the numbers, the issue that we have with this right now is that it's new, and we're scared. You know, and I don't even understand why people are buying toilet paper of all things, you know, but I mean, your people feed into this, and, you know, you saw canned foods, but there's no toilet paper. I mean, so this is what the court has called us for in order to make sure that y'all understand what we're doing. If there is a concern, there's 5 of us up here, you bring it to our attention, and we're going to do everything we can to make sure that y'all are comfortable with what we're doing. You know, sending everybody home tomorrow or on Monday, at this point, that is not an option. It just isn't. We have to continue. We're in the business of service. We're just going to have to figure out a way to minimize the impact. Okay, Commissioners?
Good. There's no test available. How was this individual tested?
They did have a test over there. There's just no test
One
here.
test?
Yes, sir.
No, it's done in Canada, it wasn't done here.
Oh, it wasn't done here where there's no test.
No, and we've got tests here, Commissioner. There's tests in the United States. We just don't have the tests in Valverde. Yes, sir. Sorry. Commissioner?
Thank you, Judge. I know you've been doing a real good job, Judge, of keeping us informed, and just let us know. We'll do whatever we can do to help people, you know, keep posted.
I'm going to open it up a little bit for some comments from the elected officials. Just don't get real strange on us. Well, I mean, you know, we're all concerned. I mean, y'all need to understand that we're taking this thing serious. We really are. We're going to do everything we can to make sure that y'all are as protected as possible. We're going to make sure that our constituents are protected as possible. And I will tell you that in visiting with the commissioners, we're working as one, and that's what it's gonna take. If we can file something, put something in place to declare an emergency or disaster, and that's what it's gonna take, and then we're gonna do it. And if we have to shut down some locations just to make sure we don't have 300-400 people in one area, it's gonna get done. But this will be evolving on a day-to-day basis. Elected officials, do I have anybody that would like to say something or recommendation? Anybody? Judge Cole?
Yes, sir. I am concerned about administration because we have individuals that come from many different countries and sometimes are here illegally. We don't know where they've been, what they've been doing, what they've been exposed to, and we are within this much distance.
Can we do a video magistration?
Sir?
Can we do video, why?
No.
Okay, can we get set up, or what would it take? Okay,
And we don't know.
let's do this. I don't know where Ram's at, or who we need to talk to, but when we leave here, let's have that conversation with somebody who can get it set up.
Don't y'all have at the sheriff's office two-way mirror rooms and stuff where they can magistrate at the jail? Sure.
There's, where they confer with the attorneys there, and it does have a lot of fairness. We can have all of, we had talked about that before, and for some reason,
Okay. Well, I mean, right now, Judge and Sheriff, it's really the time to just get it done. I mean, I'm at the opinion, and I'm sure that we all share the same opinion up here. If it's a matter of money, Matt, we will find the money. I just don't want this to be our fault, okay? I don't want anything to happen to y'all or any one of our constituents because we didn't do anything. Okay, so if we need to do video magistration, let's get it done. If they need to speak through a window or a door or somewhere that y'all feel comfortable, let's get it done. And visit with Ram. If Ram ain't here, let's call one of the techs and let's get it set up, Sheriff, if you don't mind. Now you're smiling. Who are you smiling at? I can't see who's next to you, Sheriff. Who's next to you? I can't see who you're smiling at. The warden? Okay. Well, that's good. Now he's here too, and we're all gonna get it done.
Judge, it is doable. I tried about 8 or 10 years ago to do that, and I couldn't get Geo to give us permission to get in and do it. It had to be secured. So I tried it. I even bought the computer, the printer, and everything.
Do you have all that stuff?
Well, it's there. I never got it back.
You gotta watch
So
my language, right?
it is. I'm telling you, it is doable. It can be done.
Okay. Would y'all mind after this meeting, if y'all don't mind, get together? Just do it.
Judge, one last thing, if I may. The feds have access to remote into the jail facility.
Well, my deal
If
is,
they can do it, we can do it.
okay, if the JPs, if y'all will get together with the sheriff, the warden, try to get all your moving parts together, and if y'all visit this afternoon, and if we can't find the money, which we could be able to take it from now, maybe we find the money before Wednesday.
And I wanted to advise the court that all the proceedings that I have in this court have been postponed until Monday, April 20th. All cases.
Thank you, Judge.
All right.
That take care of that, Judge? Okay. Angela?
You say, Judge, tomorrow, the schools will have a meeting.
The school will have a meeting in the morning at 8 o'clock, the school board meeting.
How will the public be notified? Is Monday to the school?
I have no idea. I will tell you that,
They have the reverse, basically it's like reverse 911. They will basically call out to every single parent. Just like when you get a call now about a meeting or something at the school district, they will send that out to every single parent.
and I will tell you with some of the suggestions and stuff that's going to go before the school board tomorrow, if I didn't have confidence in them before, I have every confidence in the world that in all the school board members. I will tell you that, even Mr. Overfeld. Just throw that out there. But some of the solutions and some of the stuff that they were doing, well, suggestions that I think are going to be proposed tomorrow, they're going, going in the right direction. And I will tell you that I sent Dr. Rios a text message a little while ago that I was real impressed. He was one of those that I think what he's going to be presenting to the school board is impressive. And I don't see a member on there that I would say that doesn't have the best interest of the staff and the students at heart. I just, in visiting with them, all I can say is I was impressed. Really was. Anybody else? Yes, sir. Judge.
I understood Judge Hernandez that all their hearings were suspended until
April. Judge, would you mind coming up here? 'Cause I can barely hear you. I'm hard of hearing anyway, so sorry about that, Judge.
Yes, I just wondered, since the hearings in the district court has been suspended for a certain time frame, and also in Judge Gonzalez's office, is that something the JP office we can also suspend?
We can visit if y'all want to do it. I don't have a problem with it. There shouldn't be a problem.
We don't need to, based on that, Judge.
Yeah.
Judge, Manning reached out to us. He meant to reach out to all the JPs, because I know the OCA wanted something, an email or something, letting them know that whether we're going to postpone some hearings.
If y'all want to follow,
And, oh, there it is. And he put something together from all of us, and so that we can send to OCA. Is that correct? Can you come on? He was going to reach out to the rest of the JPs, too, but he didn't have time to get the meeting started.
Good afternoon, Commissioners. Eric Bain, City of Del Rio Municipal Court Judge. I reached out to my colleagues here because our courts share a lot of the same functions. We have, they obviously have more functions than I do, but we all do Class C cases. We do Class C magistrations. And all of the courts in Texas got guidance this morning from the Office of Court Administration. And Judge Abels apparently has made it a mandatory closure for district courts, and I suppose the county court of law. I don't know if that applies to us, but I know that I think if that's what's going on at the district and county court of law level, I think it's something that we ought to do as well.
let's do this. Magistrations are going to have to continue one way or another.
Certainly.
We can all agree with that, right? So any hearings that y'all have, if y'all want to postpone them, is something that y'all need to do. Done?
The only issue I can see is when we have time situations like evictions.
Well, maybe I'll have to play them one at a time.
That's gonna be y'all's call. But if y'all wanna postpone everything else for a couple of weeks and follow the same timeline, that the district judges and our county court of law judge did, do it.
But we should not have to ask for eviction. Sometimes we have no.
Judge, if you wanna hold the eviction, if you wanna have it, you have it. If you don't wanna have it, don't have it. Okay?
Judge, the directive from Judge Abels did refer to urgent matters like protecting orders, family life, in terms of shutting it down first at those hearings.
So as long as we follow the direction of what we've already handed to our county court of law judge and our district judges, we should be fine. And we'll get y'all, if y'all don't already have that order, then we'll get it to y'all that directive. Would that be okay? Y'all are whispering. Are y'all okay? We're gonna get you what Judge Abel sent out, and I think probably if we follow that, we should be okay. That work? Okay. Anybody else? Before he gets up here, I want to thank Adrian for everything on the wall. Really do appreciate it. It was unbelievable. Good job.
Thank you, Judge. Thank you, Commissioners. I appreciate that. One concern is as far as our veterans going to and from Kerrville and Audie Murphy and Frank Tejeda, is Audie Murphy just delayed their campus, their clinic. As soon as these veterans are going in there, they're going straight into a screening process, almost like a pre-quarantine. And they're wanting to know what measures we're taking before we put them on the van and take them over there. We don't have nurse or anything.
The CDC has some recommendations as far as, there you go.
Yeah, that's what we have, as far as, are you coughing, have you been exposed to anything like that? That's all, as far as that's concerned, that's all we can tell them, is saying, hey,
And that's probably gonna be what we do, just refer to the CDC,
Okay.
go look at what they're doing and follow those steps. I'd go buy, some good
Definitely.
thermometers, check their temperature and whatever they're recommending, let's go do. All right?
so in the event that we get someone that may or may not be at 100.4 degrees or more, has a cough or shortness of breath, we're gonna deny them.
And we'll transport
Transportation.
them to the hospital. Or
Is that
take
be
them to the
okay?
hospital.
Just in case you guys get a phone call or something.
And you know what, a lot of common sense is just gonna have to be in play. We wanna make sure that these individuals get to where they need to be out of town, or veterans, anybody, but you make sure they get to where they need to be. But if you have somebody with 104 temperature, their chest is hurting, coughing up stuff.
They don't need to go to the VA, they can go to the hospital. Roger that, Judge. Thank you.
You can raise a piece of paper. You wanna talk, you wanna say something? Yeah, please. And if you'll tell us who you are, I already know, but if you'll let
Okay.
everybody know.
My name is Marty Faulkner. I work for Methodist Healthcare Ministries. Our main facility is in San Antonio. We cover 72 counties in Texas with registered nurses, so there's 100 of us throughout South Texas. I'm on several different boards and committees here in Del Rio, including with Roland and John for the LAPC committee. That committee has been working already to get information out and establish awareness in Del Rio. And we're also working on plans to decide what we're going to do if something happens, right, as far as what is our role. The committee that I chair is a subcommittee of the LAPC, and that's the NGO committee. So we have our first meeting on Wednesday. I've already reached out to the food bank, to different faith-based and non-faith-based NGOs that are nonprofit organizations, so that in the event that someone gets quarantined, if it does come to Del Rio on a long-term basis, and there is a quarantine, there are many people out there that can't afford to buy 2 years worth of toilet paper. They only have enough money to buy 2 to 3 days worth of food at a time. So if they're quarantined, how are they going to be fed? Who's going to feed them? So we have a meeting on Wednesday with a large group of team members that come together. We're going to develop a contact point, who will be contacted when someone is quarantined, if they need disinfecting items, if they need food, etc. You're welcome to attend that meeting. It is Wednesday morning at 8:30 at First United Methodist Church. The screening process is pretty simple. It's what the CDC is using. There's 2 steps to it. You probably, I don't know if you want me to go over it or not. I have that paper here if you want it. This is what Methodist Healthcare Ministries is using in all of our facilities. We're screening folks outside. If they meet this criteria, they're masked, taken in through a different entrance where they are treated and tested. If they don't meet this criteria, they're treated like a regular patient. I just want to say something. I know we're talking about if you have fever, if you have a cough. That's not the only criteria for COVID-19. Box 1, if you have fever, a cough, difficulty breathing or shortness of breath, or other flu-like symptoms. If you receive 1 check mark in that box, then you move to box 2. Box 2 is the patient currently under investigation or isolation by the public health system? Or have they been in close contact with someone known to be sick with or under public health restrictions or isolation? Or number 3, are they elderly, over 65, and do they have underlying chronic conditions which makes them vulnerable? So at my age, if I have a fever and no issues, that doesn't mean I'm automatically going to be screened that I could possibly have COVID-19. So, but we'll leave that stuff up to the CDC. I just want to make sure that we're looking at the CDC information appropriately. So there are some different components that
You're not throwing rocks at me, no.
No, not at all, not at all. This is very scary and it's moving very quickly. So, anyway, we will be meeting at the church, so we'll be working in partnership with the city and the county to make sure that the NGOs in our community are able to pick up this humanitarian portion of what's going to happen. I don't know if in the county's roles, you're hearing on the news today, President Trump spoke to it, some of the other officials were getting these drive-through testing sites. I know we don't have test kits because all the test kits right now are mandated and regulated by the state labs, so they're not going to all the other labs, but the president, of course, I'm sure y'all heard, I was listening to the news on the way in, to a speech that they're trying to make those available to every doctor in every area, and so maybe that's something that the county would be able to work in partnership with the hospitals to set up some of those drive-through sites as soon as we get the test kits, and hopefully it's going to be pretty soon. But if someone does get it here, I think that the hospital has the ability to request a test kit to be sent here. And so it's not like they aren't going to get tested, it's just going to be delayed. Correct?
No, you're right.
I believe that's what's
You're
trying
right.
to do that, so.
Got it, but there is none here, and that was the deal, like what you just said. They can request it,
Mm-hmm.
but it's,
But you have a delay in time before it gets here, so, but just to kind of alleviate some of those fears, it's not that we can't get any test kits, it's just they're not here at this moment, but we can request them and have them.
okay, you said it better than I did.
So-
I'm still scared.
Everybody's scared, and I think that's what's so important. It's important for us to make sure that just because somebody has a fever, it doesn't mean that they possibly have this, right? We want to make sure that we're looking at the CDC guidelines and really paying attention to that. As I was coming in, I was shaking hands and hugging people. That needs to stop. That's one of the big things. All of us in here shaking hands and saying hi and all that. It's one of the big no-nos. Right now, we're not supposed to touch anybody. So that's one of the biggest things we can educate on as well, is stop touching people. Air shake or whatever you need to do to say I love you and how are you today, but let's stop touching each other.
Thank you. Thank you so much. Yes, ma'am.
If we don't have the testing kits available, how are you confirming if they have it?
So let me just say that I do not work with the CDC and I do not work with the hospital, so I cannot give you that information. I just know that we were told that if we had a suspected case, that you could request a test kit to be sent. So I can't give you that information. I have to refer you back to the hospital and the CDC for that. But I think that what we're talking about, the ones that were here that were confirmed, what I heard from Judge Owens was that a family came here visiting, then they went home and then they tested positive. So we don't have any person that lives in Val Brae County that is tested positive. We just had a positive visitor. Is that what you were
We can leave it at
saying?
that.
So, okay. That's what I heard, so I just, okay,
We can leave it at that.
all right.
Yeah, you're good.
Okay, thank you.
Thank you. Is there anybody else for?
Raul Ojeda, Judge with City Council. I was wondering, you had mentioned earlier, the probability of the leaderships of our community getting together in order to reduce rumor and have a cohesive, leadership, voice. When do you anticipate the date, or next week or
Well,
something
what
like
we'll do is
this?
we'll send something out to everybody and sort of pick a date. I wouldn't see it till probably not this coming week, but the week after probably.
Right.
Some of us are gonna be good, some of us are gonna have to clear schedules in order to be able to make it. You know, the problem that we have with this, and we talked about it earlier, when you have this meeting, the whole thing is that you don't want a mass gathering. So now you're gonna have a gathering of elected officials, but then you're gonna have everybody else want to show up and listen.
Right.
So, do we do a video to where they can actually watch it on TV? There's certain things that we can, certain things that I can put in place that that we won't have to have everybody here in front of us.
Right.
Because that's one of the main things that we don't want is the gathering.
Okay.
So, if we need to do that, put that in place before we have the meeting, then that's what we'll do. Both the school and, the city, I believe, is capable of being live, streaming it live. So that'll take care of the rest of us. If the school and the city does that, that'll take care of the rest of us. We don't want to call the meeting and then have 400 people show up.
We don't.
Yes.
I understood.
And that's going to be something we're going to have to work out logistically.
All right.
Okay?
Thanks.
Thank you, Councilman. Is there anybody else? Sheriff, are we okay? Is there anything else that you can think of?
Just so the court's aware that, in the discussion with the warden, all visitation from the outside will be canceled this time.
Okay.
Anybody that has a family member there, not going to be allowed in.
Okay. Judges, Judge Fernandez, Judge Cadena, do y'all have anything?
I've got the letter from Judge Abels that was sent. I forwarded it to you. I've got some extra copies for the rest of the court.
They were making copies and get them all in
Okay.
copies. Yes.
And so the essential proceedings, as were alluded to earlier, are going to include but not limited to criminal magistration proceedings,
CPS removal hearings, temporary restraining orders, temporary injunctions, juvenile detention hearings, family violence protective orders, as was alluded to by the county attorney, and certain mental health proceedings. Those will be essential, and we will make sure that we get those things done.
And we'll, make sure, I know you sent us a copy, we have a copy there, we'll make sure that all the JPs, get a copy of it.
I've got extra copies with me.
Yeah.
And I'm going to share that with the media as well.
That works.
So that we'll know, and I appreciate the platform that you all are giving us to let people know what we're doing and how we're doing it.
You know, Judge, this is gonna take, like they say, the whole village to raise this family. I mean, it's just, you know, and it keeps changing. I mean, it's just like every 30 minutes you're getting something different. Somebody else has done something different or found something different, or now we have another group of people coming in and yeah, it's...
Well, I understand, we can't panic, but we must prepare the best we can. So I appreciate that. Any questions about the courts and...
I think we're good.
Okay.
Commissioners?
Mr. Councilman Smith, did you have something?
Okay, thank you. Is there anything else? And I know I'm laughing right here, but it's been, I will tell y'all that Wednesday, come Wednesday, Tuesday evening, Wednesday, all day long, my phone lasts all day long, I don't have to plug it in. And Wednesday, Thursday, and the day, I've had to charge it today, leave it in the charger, and Wednesday and Thursday was just, you know, and everybody's in the same situation. We're just trying to figure out a way to, you know, make it better for everybody, you know, to where we don't have the exposure. And I will tell you, your council, your school board members, like I said earlier, I was really impressed. If there was ever any doubt in anybody's mind that these people don't have the teachers and staff, or the staff and students in mind and their heart, with what I heard today, y'all can rest assured that they are doing everything they can possible to make sure that the kids and staff are safe. And I hope that when y'all walk away from this here in a little bit, that y'all have that same understanding from the court. I mean, we're gonna do whatever it takes to make sure that y'all are safe. And I want y'all to feel comfortable with that. We've had conversations with the commissioners, going back and forth, and you know, we have one goal in mind.
Judge, there was one thing, somebody from CDP was there.
Mhm.
They were asking the question of whether or not the bridge was going to be closed.
Yes.
They don't have any plans to close it. I've been getting a lot of calls about that.
And, yeah, and what, council just brought up, I think, Roland had a text, and I think you had texted me that if it was closed, the bridge, yesterday, the day before, and even today, don't have plans, nothing in place to have to close the bridge. So, that's another misconception, and heck, it might change in the next 10, 15 minutes. But as of, you know, Wednesday, Thursday, and, you know, 1 o'clock or whatever today, there was no plans. So, Commissioners, do I have anything? Oh, come on. Everybody else, I mean, is there anything else? I mean, the main purpose behind this meeting is just so y'all understand what we're doing. And everything that we've heard now, other than names and stuff of the individuals that might be infected, other than that, you've heard everything else that we know, for the most part.
The only thing I ask is before you start spreading stuff, make sure you get the facts. There's a lot of misconceptions out there. There's a lot of stuff on Facebook, there's a lot of stuff out there being posted that if you do a little research on, you find out that it's not necessarily true. Get the facts before we start spreading rumors. And some of those facts are not always easy to find, but, you know, the judge or the court or whoever, pick up the phone and call. And if you got an employee that's sick, they need to stay home. Even if it's just a flu, they need to stay home until we figure all this out. That's all I got.
Commissioners, all okay? Yes, sir. Commissioner Flores? You good? Everything good? All right, I hope this has helped a little bit. I really do. Again, it's gonna take a few minutes. Wash your hands, don't touch your face. You know, we heard it a little while ago that, you know, just because you have the flu, that you know, we are going to have, this is gonna be up to us. It really is. I mean, we're gonna take care of ourselves. Sheriff, are we okay? Gonna fix and close it out?
We're good.
We're good, judges?
Discussing our operating.
Okay, all right. No, thank you. Again, I appreciate y'all for coming. I really hope that y'all feel like we're trying to do everything we can to make sure that our community's taken care of. This meeting's adjourned. Thank y'all.